My name is Hannah, and I wanted to talk to you today about vocal injury prevention. Today I'd like to cover 4 steps for vocal injury prevention. This can be really important for occupational voice users, such as coaches or teachers, especially singers or performers of any kind. But it's also important for anybody who uses their voice on a day-to-day basis. The first step is hydration. Our vocal folds are kind of covered in this nice mucus layer, and they come together smoothly because of that layer. And when you have dehydrated vocal folds, it can be a little bit more harsh as those vocal folds come together. So hydration is very individualized for each person. It kind of depends on what your intake is. It's important to consider medications that could be dehydrating. It's also important to consider dehydrating drinks such as alcohol or coffee, and trying to be cognizant of those and take in water as you're taking in those drinks as well. The second thing that I'd like to talk about is kind of what we call phonotrauma, or really high intensity use of those vocal cords coming together, maybe as you're yelling, if you're a coach, or as you're singing, if you're a singer. It can be damaging to the vocal cords. And so vocal rest is really important. If you're going to be engaging in that high intensity voice use, it's important to not just whisper. Actually, whispering can make it worse, but to actually give your voice a break, kind of set out some time to rest your voice entirely. Maybe take that time to unwind or do whatever you may want to do, so long as you're not using your voice. The third thing I'd like to talk about is acid reflux. Acid reflux is when acid moves from the stomach up the esophagus, and it can come in contact with vocal cords. And if you're not sure if you have acid reflux, but you kind of do have that acidic feeling sometimes, it can be important to kind of gauge what you're eating and see if you notice any patterns in certain foods that may kind of increase that feeling, or certain times of the day. A lot of times if you eat right before bed and you lay down, that acid reflux can become worse. It can impact the vocal cords because of that acidic fluid touching the actual cords can cause damage. The fourth and last thing I wanted to talk about in vocal injury prevention is irritants. So these are kind of inhaled irritants. It can be environmental. So if there's smoke in the air or a lot of dust in the air kind of getting into your throat and into your lungs, it has to pass the vocal cords, and that can be damaging to that mucus that makes that nice soft closure of the vocal cords. Thanks for watching. I hope you learned something.